My name's Luke Brewster. I'm a vascular surgeon, and my kind of entry into the ISACB came through Howard Geisler during my research years, and I obtained my PhD in between my second and third year of general surgery residency. And we were working on growth factors to promote endothelial healing and endothelialization of prosthetic grafts. My first abstract was submitted to the ISACB in Savannah, and that was the year of, I think, right after the big celebration of Dr. Naram in '03. And Dr. Naram organized the Savannah ISACB to follow his regenerative medicine meeting. So there's really a great turnout of bioengineers and vascular biology. And it really got me excited not only about the society, but about the kinds of things that can be impactful and change patients' lives. And I really like the translational emphasis of this society. I obtained my PhD, finished general surgery, and then I did vascular surgery fellowship down here at Emory University, and was privileged to work about 6 months in the lab of Elliot Chaikoff. Both Elliot and Howard were both past presidents of the ISACB, so I had really wonderful mentoring. During those years, I got to meet a number of the kind of more recent leadership, and including Dr. Schoen and Dr. Aikawa, and really enjoyed kind of the development of the society, and was very privileged to join the executive committee in 2012 at the Cleveland meeting that Steve Schmidt had organized in Cleveland. And since then have kind of taken on different leadership roles within the society and really gotten to know a lot of our members and tried to make sure that we're not only listening, but responsive and staying dynamic, which is one of the really cool parts of this society. I'd say our dynamic arm and our friendliness and collegiality are really two of the selling points that have made me love this society. I think we need to keep the emphasis on the translational science of the meeting. I think we need to make sure that we have the clinician involvement and the patient involvement. I think our scientists and bioengineers and vascular biologists and our talent here has really grown, and it's made the meeting really exciting. And I think that we just need to continue our outreach throughout the world. I'm very appreciative to Dr. Masanari Kawa for getting the first meeting in Tokyo, albeit virtual. But the expansion of our society, making sure that we are relevant to the clinicians and to the patients is really the goal of the society. And I think as we do that, we need to pay attention to our members and our members in both their science, as well as the kind of people they are and where they come from and what their stories are and how they've been colored by their experiences. Dr. Aikawa in the most recent presidency really did a great job of expanding committees and getting inclusiveness and better gender equity. And I think we can really build on that with other forms of diversity, as well as a more broad membership base. So day 3 of the ISACB is we typically have a 3-day meeting, but in our partnership for the Tokyo meeting, only 2 days were possible. So in coordination with both Masanori and Elena Akawa, we organized a day 3 meeting that was going to be held in Tokyo at Tokyo Women's. Both Toshi Shinoka, yourself, Aggie, and Dan Simeonescu, and I kind of got a second plan when we found out that we were going to be virtual and that the day 3 was not possible in that format. And so we really wanted to bring things back into the Southeast where we have a really strong contingent of membership, and also in an area that has really great integrative science. And so we were lucky enough with our leadership from Elena to get this organized, and hopefully up and running shortly. The dates are now going to be on Saturday, September 18th. We had played with a couple different dates around that time. It will overlap with a big celebration of Bob Narum that Georgia Tech is doing. So hopefully we'll be able to enjoy the benefits of some of those folks at our meeting as well. Lots of them. I like to read and I like music. So those are my big ones. In my old days, I was a sports person. So I still enjoy watching our kids play sports and seeing them develop. And I think they get to learn a lot of good lessons that way. I'm very kind of committed, I'd say, to my faith and my family, and the kind of the generosity of our time and gifts to our fellow people. Bauer Sumpio recently on the executive committee call had brought up kind of a staged mentoring plan to getting more people involved. I personally got involved at that time. I was not quite in the PhD program. I had applied, and I was in my first year of a research fellowship. And I think that there's a lot of value for the younger people and students in getting to meet people, getting to present your work in a really exciting forum, and then just getting to talk to people. Again, there's so many people that you probably know their papers or their labs or what some of the work that they've done. These people are all sitting next to you or out in the break room, all very approachable and really interested in you succeeding and you pushing things forward. The way I like to think about it is that, you had Socrates, had Plato, who was supposed to be, even more profound. Plato had Aristotle, even more profound and impactful. And Aristotle, had Alexander the Great, who outside of, for Western civilization, at least outside of Jesus Christ, is the most impactful change on Western civilization. And Alexander the Great had nobody. And we, society, want to be earlier in that lineage. And we want you all to be people who not only develop the next generation, but also develop the generation after them. Because that in perpetuity is a kind of living forever that's really exciting. And the advances in science and the advances in clinical care really need to go hand in hand. And that requires, doing more difficult things and involving people who may not be exactly the same as you, whether it's from perspective or whether it's from the profession as a clinician or as a scientist, as an engineer. And I think this society provides that that opportunity in a real welcoming environment. And so I hope that you find the same fertile soil that I have. And if you don't, let me hear about it, because we want to make it that way for you.